Good afternoon, everyone. Wow, what a fine crowd is here at the Health Science Center today. So thank you all so much for coming to the 8th Annual CEO Awards. My name is Debbie Malloy, and I'm a Vice President here at Eastern Health. And again, it's really great to be your MC here today. Some of you would have been here last week on June 21st when we celebrated Indigenous Awareness Day. And one of the things that we noted on that day was that we didn't do a lot of land acknowledgement here, and we wanted to start to do that, and we thought today would be a great day to start to do that. So I'll begin by respectfully acknowledging that in the province of Newfoundland and Labrador, of which St. John's is the capital city, this is the ancestral homelands of the Beothuk. Today, these lands are home to a diverse population of Indigenous and other people, and we'd also like to acknowledge with respect the diverse histories and cultures of the Mi'kmaq, Innu, Inuit, and Southern Inuit in the province. Thank you. And what you'll notice throughout today, actually, is we're going to weave in a lot of diversity, and we have a guest speaker today who's here from the Native Friendship Center, which is fabulous. And Saul is actually here as well, and he's going to be performing for us this afternoon, which will be fantastic. So every year we try and expand the reach of the CEO Awards of Excellence across the region. And this year we decided to use Skype technology to reach as many people as possible. So we have people today all over the region at their computers, in boardrooms, together in offices, all joining us to be part of the CEO Awards. We're also recording today, so if you're in the audience here today, and it might pan around, so hope you're okay with that. If you do, if you're a little shy, please do let us know, and we'll try and acknowledge that. But we did want to let you know, and we think that's important as well, so that we can share today's festivities with people as well in their off hours and add it to our intranet. Special thank you to a couple of our board members who are here today, both Lynn Wade and the chair, Les O'Reilly. Great to have you here. Thanks so much for being part of it. And as we begin the ceremony, what I'd like to do, we had over 70 nominations of people for the CEO Awards of Excellence. And anyone who, and they were individuals as well as groups who were nominated. So I just wanted to ask if you're one of those people, would you stand up for me, please? That's fantastic. It's so great to see both that people are acknowledging the great work that their coworkers do, and that we could actually acknowledge you today too. There's only a small number of winners, but we know that everyone who is nominated is actually a winner, and they do fantastic work every single day. So as those of you who've attended in the past know, we always have a theme for every one of these ceremonies. And in the past, that theme has been around the fish philosophy. But this year, we decided to take you down the road of engagement. And if any of you have been on the engagement intranet, you'll know that we've depicted that as a roadmap, and that we actually have pieces on the roadmap that we expand out. And what we had heard in the past was that people didn't necessarily know what we were doing around engagement and how we were devising programs and developing things that people could be part of. So we wanted to find an easy way that we could actually share this with you. And one of the ways we're going to do that today is to focus on belong, which we think is a really important piece of the roadmap. So the employee roadmap consists of 4 different things. There's belong, which we're going to talk about today, support, grow, and achieve. And the need to belong at work is quite powerful, as well as the need to belong in your personal lives. Humans are hardwired to want to connect with one another, and that includes not just with your family and friends, but also with your coworkers at work. It helps us to achieve, to be a team, and to make sure that we're providing excellent patient care. Now, if you've attended in the past, you'll know that we always do a little video that helps to expand upon the theme. And our exec committee poking a little fun at ourselves, and Phil Sims from Communications, he doesn't really tell us a whole lot about what the theme is or what he has us doing, but we're good sports about it, and we try to put it together. So I guess we're going to roll that tape. So go for it, Phil. Or, ever feel like you don't fit in, that you're often left out, or just plain different? Introducing Easy Belong. With this exciting, new, custom, ultralight patented system brought to you by the makers of the Employee Engagement Roadmap, you too can easily belong in no time. No longer will you just sit around. Instead, you will learn to create a connection between you and your coworkers. Belong while being yourself. Achieve goals as a team. It's that easy with Easy Belong. I tried fitting in using conventional methods, but none of those seemed to work. But now with Easy Belong, I'm one of the with Easy Belong, my team's productivity increased by 400%. Thanks, Easy Belong. Easy Belong is a system that transforms the work environment. It's so easy, you might think it's magic. The secret is Easy Belong's groundbreaking, state-of-the-art techniques. By redefining the way we interact with each other, it's scientifically proven to affect happiness. So now, these are only available to an exclusive few. But today, with Easy Belong's revolutionary patented new system, you too can easily belong. Feel a part of something bigger, connect with others, achieve goals together. How much would you pay to belong? $500? $300? 4 easy payments of $29.95? Well, call now and you can get Easy Belong at the introductory offer of absolutely free. That's right. Call now and we'll send you the revolutionary custom ultralight fat-free interchangeable system absolutely free. But wait, the first 13,000 callers will not only receive the Easy Belong training system absolutely free, we'll also include the entire roadmap series at no additional charge. Here's the order.
Easy Belong toll free. 5555. The first 13,000 callers will also get the entire employee engagement roadmap absolutely free. This over $400 value is yours, absolutely free. Some additional charges may apply.
We're not asking any money for this, like none. This totally works. Thank you to Phil. That every year he comes up with something and he makes us all look somewhat fun, I guess. My apologies to anyone from the OHS department who's in the room. Both Ron and Ken have had a little bit of counseling around hazard assessment after we did that. So these videos add a little bit of fun in our workplace, but there's always a little message in there too. And of course, in this particular one, it's all about belonging. And today's event is really proof about the value that we put on both big and small contributions of our people. So from the incredible, swift, and high-pressure work that's performed by healthcare professionals, to the talented skills of a surgeon in the operating room, to the dedication of our support services staff, or the helping hand of a clerical worker at one of our registration areas, or the smile of a volunteer. To belong really doesn't just happen naturally for everyone. It begins with one person, and it grows from there. When someone helps you with a helping hand, when you receive some encouragement, and when you greet others first thing in the morning, you're going out of your way to make someone feel welcome and to feel belonging in the workplace. So I'm going to ask you to play with me for a minute or two. I'd like you to think about why you feel you belong at Eastern Health. And I'm going to ask you to turn to the person next to you and just take a few seconds and tell them why you think you belong. Yeah, I mean it. Come on. Come on. incredible is that? I see people smiling, laughing, telling each other that they appreciate some little thing they're doing, saying, why is she asking me to do this? All of those things happen in the room, but that's fantastic. And I encourage you to go back to your own workplace and just take a second and to ask people why they feel like they belong and to make them feel welcome as well. Jose actually went around the region and she took a video, and we're going to show you this video, and she did exactly that. She asked people from all over Eastern Health Region why they feel like they belong. So we're going to play that for you.
I find it's about making a difference, and one of the parts about this job in particular is the home patient piece, where we take the dialysis to the patient's home right across the province, and we travel to their homes, we set them up, they become part of the community again.
The caring in those relationships that I feel every day, and that I feel every day.
That's what solves it. I enjoy my work.
Solid training, jobs, feel comfortable. We've always respected each other and the roles that all the team members have had.
It's like my second family. It's a home away from home, and every one of those residents mean the world to me.
Very thankful to work in a setting that has moral values that coincide with my own moral code. So I feel supported by my supervisors, management, and the care I provide.
I feel part of Eastern Health. I feel I'm always involved in the decision making, which enables me to do my work adequately, efficiently.
I feel very appreciated. I find the co-workers, management, staff, and all the departments of health science appreciated whether you're doing an office or a clinic. The public, everybody appreciates holes in the wall being fixed. Your satisfaction when you feel that your work is being appreciated.
In the department that I work with, there was actually people from 14 different countries, from 5 different religions. We work together as one group, providing services to our patients and co-workers.
Yes, people have been transparent and open and supportive, and that has really made me feel part of the team.
Solving issues with indigenous people coming from Europe, and being able to accommodate them of their needs.
What I would think that someone who's walking, especially a younger person, first job, welcoming patients, just show them the ropes. Come sit with us, have coffee here. We're going to break now. Come on, let's go.
I guess to let them know that their opinion is valued as well, and to encourage them to participate in the same sort of things, so that they feel they have a relationship with the groups.
We'd like to pay back to other units to show our support for the work that they do.
I think that it is almost a two-way street. So one, I think that the organization needs to be willing and open to different perspectives, different backgrounds, different experiences, and learn from those and see how they can, be adapted. But I think also on the end of the person, there also needs to be a willingness to be open and, to sort of take accountability that, I'm choosing to be here, to be in the organization, and to make a difference.
To hear a little bit about that. Jose, I just want to tell you, is very talented. She shot that on her iPhone. I'm pretty impressed. I think she had a little help putting it together, but there you go. It was great. So things you can do to help others to feel belong when you go back to your place of work. If you're not already doing it, get in the habit of telling people why the work you do is meaningful. For some people, that's really obvious if you're providing patient or resident care. For some people in the back office, that's not quite as obvious, so making those connections is really important. Second thing you can do is to thank those that you work with. Small things, a little thing that may mean nothing to you means the world to somebody else. So taking that time to say thank you is so important. And the third thing is to remember to celebrate and to do it together, just like we're doing here today. So I know I've talked enough. And really, the moment you're all here is really to hear a little more about the CEO Awards. So please join me in welcoming our CEO, Dave Diamond, to the stage to give out the first 3 awards.
Thank you very much. Thank you very much, Debbie, and good afternoon to everyone in the room and to all of you back in your offices with your socks off and your coffee mug and your kicked up. Happy Recognition Week to you all. This is a great day. Wow, what the video is, that last video was, well, the first video was pretty fantastic too, but the second video, I know how that was made because I was part of that. I had actually no idea what I was part of, but I was doing some discussion with Jose about the CEO Awards, and we were going through the nominations, and at the end, she whips out her iPhone and she said, I'm going to ask you a question now. Here's the question. And so I know how much I struggled and fumbled over that, but the folks who did the sections here, so I'm assuming that they got the same treatment as I did. But it's almost emotional to listen to that. Eastern Health is a great organization. Talk about belonging. Everywhere I go in the country, I'm as proud as can be to say that I'm the CEO of Eastern Health. Wherever I go in the province and people I talk to in different provinces, I'm very happy to say that I'm part of the leadership team and part of the broader team here at Eastern Health. Being the CEO of Eastern Health is a great gig. And not only do you get to star in your own movies as the CEO, but they let you create your own awards. And so this is one of those special days of the year for me, the CEO Awards of Excellence. Today's event really underlines the theme of our strategic plan for 2017-2020. I know all of you know this off by heart, but in case, the title of our strategic plan for this 3 years is Lighting the Way and Navigating Together. And this is a really nice reminder of all of the good things that we can accomplish together in a very short period of time when we're all rowing in the same direction. And that's really what our plans are all about, working with the board and working with our executive and working with the leadership and the staff, all 13,000 of us rowing in the same direction. And the things that we can do for the benefit of patients and clients and the population of Eastern Health in the province of Newfoundland are almost limitless. And we're seeing that happen. And every year when I go through the nominations, and it is a real pleasure for me to do, and I look forward to it. This is my 4th time through it now. And to get the nominations and the 77 nominations this year, and to have an opportunity early in June to sit down and to read through all of the good things that are happening, it warms the heart, it really does. This year, as I say, we've received 77, and I can tell you that each employee in that group of 77 is worthy of an award. I guess as a CEO, I suppose I could create 77 awards. I haven't talked to Jose about that. Maybe that's the answer to the difficult task of narrowing these down. But I want to applaud you, as Debbie has already said, for those of you, the 77 nominations, and then many others of you in the room and around the region who could have been nominated for your talents and your skills and abilities. And most of all, for your commitment to excellence. And it's one of the things as I go all around the region, I'm most impressed with this. And again, I just hear it come through in spades with the little snippets here. And maybe Jose could go around afterwards and she'll catch every one of you. But I'm sure there's a story in every seat in this room and around the region of those of you who are committed to excellence. And that's what makes this such a special place to which to belong. Our recognition event is a fantastic occasion to recognize employees who, through your actions, have received the nod of your coworkers, or for some who have stood out and will receive the CEO award today. This is a really special award, and it's more special than most because most of those 77 nominations have come from your peers. So it's people who work around you that see what you do every day and the impact that you're making for patients and clients and the people of this region, or it's your supervisor, or it's a clinical leader, or it's a physician. And so it's really special in the way this happens and the way you get identified as somebody in the organization committed to excellence. And I can speak for the entire leadership team, and that includes our board and includes our executive team, most of whom are here today, to say that we couldn't be more pleased with the staff that we have and the physicians that we work with, the wonderful management team, and what happens in Eastern Health every day. And having said that, let's give everyone, all of yourselves, but in particular the 77 nominees, big round of applause. The number of nominees received this year is evidence of the extraordinary talent we have here at Eastern Health. And so we'll move now into our celebration of the accomplishment of our nominees. We're going to present awards this year. Well, we're going to present in the first phase of our awards ceremony in 4 categories for the CEO Awards of Excellence, and they include connectedness, human spirit, innovation, and leadership excellence. The connectedness category, which is our first category, is a team award. And to be qualified for this award, nominators were asked to consider the team's commitment to fostering Eastern Health's vision and values through their work in the provision of care or service delivery. These teams also understand the importance of working together for the greater organization, of enhancing the ability of programs and departments to learn from one another, and the value of seeking and creating opportunities to collaborate with others. They develop, manage, and maintain partnerships with community stakeholders to build capacity and to strengthen the ability of people and groups and communities to effectively address local health issues and concerns to help achieve our vision. Let's take a look at those who were nominated now on the screen.
The CBS Mental Health Leadership Team, the Document Vault Team, Clarenville Protective Community Care Residence Team, Side 1, the Children and Women's Health Leadership Team, the Visual Management System Project, the Colposcopy Electronic Medical Report Implementation, the Aboriginal Patient Navigators with Professional Practice and Aboriginal Health, the Provincial Incident Employee Reporting Eastern Health Team, the Cardiac Data Quality Initiative Team.
I'm my own Vanna. The CEO Award of Excellence for Connectedness this year goes to the Aboriginal Patient Navigators. I don't know what you're going to do if you consider the national share. Thank you very much.
Thank you so much.
Congratulations. Congratulations to Katie Dicker and Saul Semagak. Next up is the Human Spirit Award. Individuals nominated for this category are an inspiration to all by their demonstrated commitment and meaningful contribution toward improving the lives of those they serve, including patients and clients and residents and communities. And the nominees are
Housekeeping staff at the Dr. L.A. Miller Center, Sister Diane Smythe, Sheila Whalen, Brenda Gillingham, Rosemary Deer, Leo Martin, staff at Pleasant View Terrace at St. Luke's Homes, Dwight Crocker, Donovan Han, Dorothy Hines Fitzgerald, the 5 South A team with the Cardiac Critical Care Program. Jill McDonald, Barbara Albrechtson, Ron Corcoran, Dr. Leslie Turner, Jean Ann Ryan, Jolyn Skinner.
What a fabulous list. And the winner of the CEO Award of Excellence for Human Spirit this year is Leo Martin.
Myself. Congratulations, Leo. I don't know if I'm supposed to stand here for a picture, but there's not one soul here with cameras. Congratulations.
Next are the nominees in the innovation category. And these individuals have developed or implemented innovative ideas that result in measurable increase in quality, efficiency, and productivity. We've spent a lot of time in the last 6 months or so, and probably longer than that, talking about innovation in our organization. And there's some fantastic things happening in innovation. Some of it is technology, and some of it is new electronic ways of doing things, but some of it is just new ways of doing things, new models and new ways of caring. They have either created an original idea or uniquely adapted an existing program, process, or concept, which resulted in a long-term benefit to our patients, clients, or residents of Eastern Health. The nominees are
Christine Abbott, Dr. Heather Quinlan, the West End team with the Mental Health and Addictions Program, the Document Vault team, the Mental Health and Addictions team on the Burin Peninsula, the Cervical Screening team, the Chemotherapy Dashboard team, Paul Norman, the Healthcare Technology and Data Management Footprints Support team, the Employee Portal Implementation team, the Tobacco Cessation team, the Office 365 team, the Remote Patient Monitoring team, the Central Intake Database Development team, the 2 South Rehabilitation team at the Dr. L.A. Miller Center.
So you can see how difficult this challenge is to narrow that down to one. But this year we're going to award the CEO Award of Excellence for Innovation to the Mental Health and Addictions team from the Burin Peninsula. While folks are coming to stand here in the front, let me tell you who this team is comprised of. Diane Dunphy, Mary Williams Fewer, Marguerite Riggs, Heather Bungay, Ingrid Barron, Lorianne Pilgrim Greening, Bernadette Linderman, Cheryl Baker, Jeff Moulton, Kim Slaney, and Charlene Evans. And this is the team, you've probably heard about some of the work in the media that's happened on the Burin Peninsula over the last year or so, arising from some very tragic circumstances around suicide. And this is the group that have taken that on and taken a very long and difficult wait list down to zero. And the work that they've done have not only made a significant difference for the population on the Burin Peninsula, but it's a model that's now being transferred to other parts of our Eastern Health region and other parts of the province. And so as we look at transforming mental health and look at what innovation can do for the benefit of our patients, I can't think of a group more deserving than this group. So congratulations.
Thank you.
Elaine had to wait until I was out of the picture to get. At Eastern Health, we need individuals who demonstrate strong leadership skills and capabilities. Individuals considered in this category are not only formal leaders, but can be also informal leaders too. Our leaders promote the diversity of people and ideas and work-life balance, recognition, and teamwork practices. And they're also mentors and coaches, and they empower and support employees in all phases of their careers. These individuals create and sustain an effective and engaging environment while supporting team harmony. Let's have a look at the nominees in the Leadership Excellence category.
Doreen Shepherd, Maureen Moores, Carolyn George, Eileen Yard, Dr. Barati Reddy, Joanne Rose, Janice Manuel, Cheryl Fazarek, Joan Versey, Carla Rumbold, Melissa Kosh.
And the winner is Melissa Kosh.
Thank you very much.
Oh, she's going to get me in the picture.
Thank you.
What a fine bunch of winners that is. And congratulations to everyone who was nominated as well. And Dave is right. We have a group of people actually that spend some time going through the nominations as well. And I know it's very, very difficult to try and to narrow it down when there's so many deserving people. Before we go on to the last three categories of the CEO Awards, I first wanted to introduce you to our guest speaker today. His name is Chris Shepherd, and he's the Executive Director at the St. John's Native Friendship Centre. So Chris is going to talk to us a little bit today about the importance of belonging from an Aboriginal and Indigenous perspective. So let's hear his story. Come on up to the stage, Chris.
We'll apologize for my voice first. Of all the times that I've had to speak in my life, this is the first time that my voice has almost disappeared. So first I want to thank you for the invitation to the CEO Awards of Excellence, and even to be given the opportunity to provide some words around the idea of belonging and what does that really mean. For me, I really like the second video at the end where there was a woman who had talked about relationships. And to me, in the Indigenous community and in the Indigenous world that I see every day and live in every day, pretty much everything that we do and all the conversations that we have are made possible by relationships. When we talk about belonging and relationships, you know, they are challenging and it's hard. To have difficult conversations around belonging, you need to have a relationship that can survive some of those conversations. And so our relationship with Eastern Health is, I'm either very wrong or very right that it's about 10 years this year. And that was around the creation of what we now call the Aboriginal Patient Navigators. And those initial conversations, and I was there, thankfully, and I'm still around, were very hard. You know, how do you start having conversations about topics that not everyone feels very comfortable talking about? You know, we don't have the luxury of living in a province where we have a very robust education system around the Indigenous community, around what that looks like, some of the challenges and successes that come along with that. And so when we started the process and the background work on that program, it really came down to relationships that could survive challenging conversations. It was even more challenging 2 years later when the transition happened from the Aboriginal Health Transition Fund to being supported by Eastern Health directly. You know, how do you justify that support? How do you get enough support from, you know, the health authority to even continue this program and make it happen? And so some of those conversations, while challenging, led us to what is now a very successful, a very important part, not only of the work that happens here, but the work that happens at my organization. It allows us a really good insight into health outcomes of Indigenous people who access services here. It gives us really good insight into what people's actual experiences are. Do they really feel like they belong? Do Indigenous employees of Eastern Health really feel like they belong? Do patients feel like they even belong here? And while sometimes challenging, the work of the APNs and the health authority really works towards that feeling of belonging for people when they're far away from home, or even when they're here and you feel like you don't really belong. And so I think my challenge to everyone and in every conversation that I have is, you need to be willing to build a relationship that's strong enough to stand the 10-year test of time. A relationship that can survive, you know, the really difficult conversations about the Indigenous identity of this province. The reality that we live every day when we don't really always see ourselves reflected in properties, in spaces, in media, in presentations, that those conversations, while hard, are required to move us all forward together. And I really believe that our relationship with Eastern Health allows us to have some of those really challenging conversations. And people who have been in any meeting with me know that I push, that I'm a pusher, that I like to challenge people's ideas of what an Indigenous person is, what an Indigenous person is capable of, and what an Indigenous patient might be able to teach you about yourself and about them and about the worldview that they have. And so an interesting thing that we started recently in partnership with a few partners is a diversity project and a research project around what are people's experiences really like? What are Indigenous patients' experiences when they access services here? And I really believe that it's important to have multiple perspectives and how people feel from the outside. I have a very strong idea or knowledge and understanding of what the patient's experience is. But I also know that as a non-Indigenous person working with Indigenous patients, there comes a lot of stress and anxiety of not saying the right thing, of not knowing the right things. And I think that, you know, my words to everyone here and why I picked relationships is that the Friendship Center exists to support not just the Indigenous community, but the broader community of St. John's. And the APNs are here to help with that navigation, but they're also an amazing resource for all of you. And that when you feel that discomfort and you don't know exactly where to go, that you can reach out to us and find a way to build a relationship to ask those uncomfortable questions. And I think this research project will help solidify some of the learnings and knowledge and wise practices that we know exist. And so my other challenge for all of you is, you know, to learn something, to look up something, to, you know, understand a bit more about your Indigenous colleagues, and to recognize that they exist at Eastern Health, even though we may not think so. And so I really, really want to thank the Health Authority for being open-minded and to being welcoming to us and to really working with us over the last 10 years to make sure that the health outcomes of Indigenous people who find themselves here are the best that they can be. And so with that, I really want to, you know, press upon everyone that we aren't that scary. It's not that intimidating. But that we are really open and willing to teach and to help people understand. And that moving together in that direction makes us all feel like we belong. It makes us all feel comfortable to walk in through your doors. And, you know, even though that might come with some challenges and some challenging discussions sometimes, that's needed, you know, to move forward. And I'll end with a quote that I heard in Alberta that I adapted to here because I'm from Northern Labrador. But I was at a session with an oil company, and you can imagine the tension in a room between an Indigenous people and an oil company. But an elder got up and said that, you know, it takes tension to braid sweetgrass. Without that tension, you're not getting what you need at the end. And so I thought about my life and my grandfather's teachings around making snowshoes, and it was the same idea, that you need that tension to make sure the snowshoes lift you up when you need to. And without that tension, that success of being on top of the snow doesn't happen. And so even though it's uncomfortable, that tension is okay. And those learnings are okay. And so that's what I want to leave with you is that, you know, there's lots of examples of where tension is okay. And it really helps people have the conversations and build the relationships that are required to really feel like you belong. And so with that, I want to thank you so much.
Thank you very much, Chris, for that important message around belonging and relationships. And we certainly at Eastern Health have come to value the relationship we have with the Native Friendship Center. And, you know, there's lots of good things happening around Eastern Health across in the whole area of diversity and with Aboriginal or Indigenous, also on the tail end of Indigenous Awareness Week last week. But we know we got a long ways to go, so there's lots more to do, and so the relationships that you've talked about will continue to be really important for us, and we really appreciate you taking time out of a busy schedule to come and share that with us. Now, when Jose, I mentioned when Jose did the little video clip, which I didn't realize was going to be on the screen today, and she gave me 6 seconds of preparation to. She asked me a question, and she asked me a question around belonging and what belonging in an organization or in a team meant to me. And so I stammered and struggled through a response to that. And I was intrigued to see when I did my preparation for the day in the notes that she had done up for me, my words are here, a little story that I shared. And so apparently I'm supposed to share that with you. And but she asked the question about belonging and what belonging meant to me, and you saw a little clip of it there. But I talked to her about my experience being part of a team and now leading teams. And there's nothing magic in what I'll say, but I'll share it with you. And if there's a tidbit of something in there to take away, that's great. If there's not, we won't take up too much time with but I talked about transparency and being part of a team and how important it is actually to share information. And I shared a story, two stories. One, when I was a master's student, and I was doing a master's in health administration, and I had to do a summer work term with a CEO in a little town in Alberta called Wetaskiwin. It was an hour's drive. I'd drive out through farm country every morning, and I'd do my day with this CEO. But this CEO, unlike any work term I had ever done before, allowed me to spend most of my time in a chair on the end of his desk. And so everything that he did in the run of a day as a CEO, I was part of. And boy, did that ever make you feel part of a team. And so whether it was a conversation with a politician or a difficult discussion with a physician or doing recruiting or whatever it happened to be, at whatever level of his day, that he shared that with me. And so very quickly, I became part of his team in a way that I never thought it could be. And I left that, and then I went into as a brand new vice president in central Newfoundland. Some of you will know Don Keats. Don was the interim CEO prior to my coming, but when I went to Grand Falls, Don was the CEO, and he had built a new team around him. Most of us were brand new VPs. We had no idea what we were doing, but Don was our mentor, and Don did the same thing there as I had experienced in Wetaskiwin, and all of the activities of that team within that executive team was totally transparent to those of us who sat around that table. And so I was the VP of HR, and so there were certain HR things I had to know. But I knew everything that was happening with that team, all of the politics stuff and all of the board stuff, and I knew what was happening in clinical. And as a result of that, then that, to me, I felt like a team. I would have done anything for that team and for that CEO and that person as my leader. And so we have tried as a senior team here to replicate some of that. And so I felt such a sense of belonging that it's really important to me as a CEO with the team that is around me. And, you know, that starts with the executive team and hopefully fans out from there. But, you know, I think when I was being recruited, one of the neat things they did in the recruitment process is they brought all of the VPs together, and I actually had to do an interview with the people who were going to report to me. And I think at one of my comments there was, you know, 98% of what I know as a leader of this team, you will know as people sitting around the table, because that's what makes me feel part of a team I'm communicated with. People are transparent and that's the mantra we've tried to live. And the 2% that you won't know was because somebody told me I couldn't tell you. But other than that, everything you will know. And so I think that helps me feel part of a team. I think that helps us as an executive team feel part of a very tight-knit group, and that's how we manage here. So there's nothing very magic in that. And as I'm saying it, and even as I read it in preparation for this, is not very sexy, but it's very powerful. And so it might be a tidbit in there that's significant for you in your own team environment, because you don't have to be part of an executive team to deal in that way, to work in that manner, to be open and transparent and sharing information, and so that everybody feels part of the team and not left out of that circle. That's my experience, and I had to share that because Jose told me I had to do that. So being transparent. Let's continue on with our awards, and our next category, very fittingly, is mentoring. And a mentor is someone who advises, trains, or coaches other employees in such a way that motivates them to excel. Nominees in this category had to demonstrate a willingness to engage other employees and actively look for ways to guide other employees to achieve their goals. Let's look now at the nominees.
Linda Turner, Diane Bauman, Dr. Keith Boakey, Thora Stanley, Troy Mitchell.
And the winner of the CEO Award of Excellence for Mentoring for this year is Diane Bowman. The next award is our Safety Award, and the Safety Award acknowledges a commitment to safety at all times and in all work practices. Nominees take part in training opportunities, show an understanding of safety practices within a specific workplace setting or at an organization-wide level. Let's roll the video and have a look at the nominees.
Renee Dobbin, the Violence Symposium Team, Christine Nicholas, Craig Steele, Ashley Costello, the Parking Lot Safety Group, the N4B Forensic Nursing Team at the Waterford Hospital, the Occupational Health and Safety Committee at the Agnes Pratt Nursing Home, the Occupational Health Team with Human Resources, the Resident Care Managers at the private Josiah Squibb Memorial Pavilion.
There you are, another great list, difficult list to choose from. The CEO Award of Excellence for Safety this year goes to the Agnes Pratt Occupational Health and Safety Committee. And while they're coming to the front, let me read the names of the folks who are part of this significant committee. Derek Gullidge, Charmaine Petton, Victoria Goodwin, Joanne Buckingham, Debbie Baker, Mike Byrne, Catherine Dillon, Elizabeth Clark, Ruby Warford, Nikki Williams-Freak, and Heather Reardon. So congratulations to them. Picture? At the end, okay. Thank you. I think we're going to do pictures at the end. There you go. And our last category, but certainly not our least, is the service category, which is intended to reward individuals who are a model and inspiration to other employees in their dedication to excellence in their work. Nominees must demonstrate outstanding dedication to their work while maintaining a high level of commitment to the Eastern Health vision and values. Let's look now at the nominees.
The coding and abstracting team. The organ procurement team. Ron Murphy. Tammy Collins. Dr. Jasbir Gill. Matthew Neal.
And the winner is? We haven't had any drum rolls still. I'm just realizing that now. We're at the last award. Let's start over. The winner of the CEO Award of Excellence for Service this year is Ron Murphy.
Congratulations, Ron.
Well, there you have it. I want to say congratulations to all the nominees and also to the winners of the CEO of Excellence.
Attention all construction in the area. Case or fire emergency, please call extension 2000.
That's Joe Dunford has been left us for about 4 years, but I hear him every day on that system. Congratulations again to everybody, all the nominees and all the winners. These are outstanding accomplishments, as you can see, by the caliber of the folks that have been nominated and have won the awards. And we all feel very fortunate to be working alongside such a talented and caring group of individuals. As we wind down our ceremony today, I want to ask you to reflect on the theme for this year. Please remember that the journey to employee engagement begins with a sense of belonging. That's not new to any of us because we all have that same need for belonging, whether you're the CEO of Eastern Health or wherever you work in the organization. We all have those same needs. To belong means that we feel part of a team, part of something bigger than just being ourselves. And it's key for human motivation, especially in times of uncertainty and change. And that's all around us. And so belonging is really important. To belong means to give ourselves permission to be ourselves. That includes all of our ideas and creativity that lead to innovation and performing to the best of our abilities. Oscar Wilde once said, "Be yourself. Everyone else is already taken." So this really sums up what it means to belong at Eastern Health. Let others see who you are and what you're made of. Let others in on what inspires you and your work. Do it best. Do it as best you can. And lastly, do what Oscar Wilde says, be yourself. Be proud of who you are and your work. And we all bring something of value to the team. And lastly, to belong means knowing that your contributions and the contributions of the person sitting next to you matter and matter a lot, and that together all of us are valued and critical to the team's overall success. Please take pride in your own accomplishments and the achievements of those around you each and every day, and not just during recognition week. one of the things that, I've been in my role now for 4 years, and I just reflect on a discussion we had at one point within our management group around our reputation as Eastern Health. And people used to tell me as I went around the region, in fact, people used to tell me if I met them in the mall, it must be some hard to work for Eastern Health. You must have the worst job in the world. And I have said from the beginning, I think I have one of the best healthcare jobs in the world. And I think Eastern Health is one of the best healthcare organizations in the country. But the public and the political folks and the media folks will only believe that if we actually believe that. And I believe that really strongly, and I know most of you do in this room. So I would ask you, let's foster that sense of belonging to something that's really special, and then share that like crazy in the mall, around the dinner table, wherever you are, because this is a really special place to work. And I think most of you here who are working with patients, and you see that every day, it's never without warts. Any organization this big, there's always something to be improved, but there's something really special in Eastern Health. And so I hope you go away today feeling that you belong to something really special, and don't be afraid to share that, because I think the public also needs to know the special things that go on here at Eastern Health. So on behalf of the leadership team, on the executive team and the board, we want to say thank you for everything that you do day in and day out to make it as special as we've talked about. And please enjoy the rest of Recognition Week. And I'm going to ask Debbie to join me here at the podium and close out our afternoon. Debbie.
Thanks, Dave. And again, congratulations to everyone, all the winners today, and for everyone sitting in this room, because we think we're all winners, aren't we? Come on. So for everyone who attended today, thank you, especially all those who are out on the Skype broadcast. It was great to be able to do that across the region. And I just wanted to do a little thank you to the planning team who helps put this together every year. They didn't put their names, Dave and I probably noticed had a few notes, and that gets put together for us too. And they didn't put their names here. So I'm going to take a guess, but I'm probably going to leave a couple out. So Renee and Bev and Jose from HR. Phil and Zelda from our communications group. I know Elaine and Brad are here from our HTDM group. So would you put your hands together, because they make this really worthwhile. Just a couple of really quick things before I ask Saul to come up, and he's actually going to do some drumming for us to finish us off today, which I think is really fantastic. For those of you who have a great story to share, we heard some of them today, and you're reading some of them in the program, but there's 13,000 of us, and we have 13,000 stories. So take the time, if you have a story to share, go onto the Recognition website, contact communications. We love to share those things through social media. Sometimes the main media doesn't pick it up, but social media always does, so that's fantastic. And I would also ask you to, for those of you who did win CEO awards today, if you'll just hang around after for a few minutes, we want to get a couple of photos. And so now I'm going to invite Saul up to do a little bit of drumming for us as we finish off today. Thank you.
To do some drum rolling. Anyway, the last couple of days, Katie was asking me what I was going to sing like for today. I said, I don't know. Anyway, being today for the CEO Excellent Awards, I just want to sing in Inuktitut Tanai Nogami, which means this person being alive. So.
Well, that brings us to the end of today's CEO Recognition Awards. Hope you all leave here today feeling like you belong. That's the whole theme of our day today. Enjoy the rest of Recognition Week, and remember to say thank you to everyone. So thank you all for coming. Bye-bye.